So my journey from being a psychiatrist who used to work in a hospital setting to becoming a public mental health practitioner really happened when I first went to Zimbabwe, and I discovered I was in a country of 10 million people with just 9 psychiatrists. And I realized that the model of mental health care that was being practiced in big teaching medical colleges was simply not practical for the majority of people in developing countries, including India. In my view, all health problems, and this is particularly true of chronic diseases, which include, of course, mental disorders, that in these groups of health conditions, no single cause can be found for these conditions. And typically, we can best understand the distribution of these conditions as a result of the interaction between social factors, such as poverty and gender inequality, and biological factors. The social determinants in health approach really requires us to always be aware that social factors play a very important role in the causation of health problems, but also play a very important role as consequences of health problems, including access to health care and health outcomes. So therefore, it makes us more conscious to ensure that when we are organizing healthcare interventions or intervention programs for prevention of disorders, that we are targeting these social determinants. It makes us conscious of issues of equity when it comes to the way we allocate resources. I think, though, the limitation of the social determinants approach would be that if we exclude any recognition that individual biology, for example, also plays a very important role in understanding health problems, and certainly in one area that I work in, which is mental illness, depression and suicide as an example, sometimes the social determinants approach overwhelms any notion that there is also an individual biological pathway that is at play here. I think there are many examples of policies that are seeking to address the social determinants of health. Perhaps the best example of the current government is the Swachh Bharat Abhiyan, where apart from the obvious environmental advantages of having a clean India, there are obviously very important explicit health advantages of having a clean India. The same could be extended to a variety of other public health social interventions, such as, for example, access to clean drinking water. I guess from a mental health point of view, the most important examples are programs that are seeking to address gender-based violence. It's important to remember that when we are addressing social determinants, one shouldn't just look at the instrumental value of those interventions. That is to say, we're not only addressing social determinants to improve health, we're actually addressing social determinants like gender-based violence because in and of itself it's an important goal. But a secondary and a very important consequence of addressing a social determinant could also be that it reduces health burden in the population. In my view, it can be strengthened further by doing a health assessment of every social policy, because social policies are not only those which can improve health, but they can also damage health. And I'll give you one good example. The social policies around the taxation of foodstuffs is a great example of a social policy that can sometimes damage health, for example, by making unhealthy foodstuffs more easily accessible and affordable, particularly to children and young people. I think the single most important lesson I have learned is to think of public health as an interdisciplinary field. Do not believe that our solutions to health problems lie in only one or another kind of approach. Typically, we need to mix and marry approaches. Not only does that make the work of public health so much more stimulating, but you're far more likely to find practical solutions to very complex problems.